The World Health Organization has described Nipah in its top 10 priority diseases, along with the pathogens like COVID-19 and Zika virus, because of its potential to trigger an epidemic. Joining me now to discuss this further is Parvana Valieva, a member of the Parliament of Azerbaijan. Welcome this morning.
Thank you for having me, dear Nadia.
So my first question about this is, what has driven this particular outbreak, and could it spread further afield? What are the other neighbouring countries doing?
Extremely rapidly changing world, no country can be secure if others vulnerable, and there are some security issues for the countries, threatened countries that has now no borders. That's one of them is health security, public health issues like Nipah virus, viruses, bacteria, overall epidemics, pandemics, now no borders. And can easily transmit as fast as we imagine. We have lessons learned from COVID-19 pandemic that we saw that how a virus can disrupt economies, destabilize societies, reshape geopolitics, even redefine national security faster than any conflict. So here multilateralism is very important tackling with epidemics, because as we said, viruses can't spread easily, and no one nation can save their health systems alone. Everyone should do something, everyone can play a role, and in this case, again, global health diplomacy is very important, and financing for global health is very important. But unfortunately, today, in many donor countries, global health financing stopped, and this created a constrained budgetary environment for health systems. And if this tendency continues, we have some reports, for example, 2025 OECD report warned that if this tendency continues, I mean these trends, under investments in health, it will significantly trigger also economic growth. It's very interlinked with economic growth. As you are healthy, you do your job, you go your work, and you support, you have some contributions to economy. But if these trends continue, this will weaker pandemic preparedness, then delayed outbreak detection, more preventable deaths, because there are diseases kind of HIV/AIDS, malaria, Zika virus, TB, and etc. They have available vaccines, treatment, but they are not accessible in every part of the world. Accessibility is very important. Unfortunately, we lose the people because of global health financing constraints today.
So in that sense, do you think that this outbreak could be a sign of things to come? Now that the US has pulled out of the World Health Organization, do you think that there are wider implications to that?
I think yes, because investments in health is very important. Some countries, for example, low and middle income countries, they are extremely dependent on external donor support, and it means that if external donor supports stopped, then their health programs stopped, challenges their programs, as well as provision of life-saving drugs, medicines for the people. It means that we will have more deaths, and this will, I would say, just trigger also economic growth.
And I guess with that, is the WHO still fit for purpose? And what I mean by that is that it was formed in 1948, just after the Second World War, to focus on global health. But since its formation, it's had a number of failures, some heavy criticism over its response to the outbreak of Ebola in 2014, and no longer committing to eradicating the malaria virus either. Do you think it's still fit for purpose?
I think World Health Organization, also UN, have their own history, norms and standards. They have science guidelines. Also, they have some advocacy to the countries take commitments and they take some targets, and then they work to achieve these goals, these targets. I think the UN is there for more than 80 years. They have best practices. They have quite qualified experts that also they developed guidelines to fight against diseases, fight against outbreak. So this is worth to use their core principles. For example, in our country now we are accelerating, improving primary health care system. We have some a concept that is strengthened concept, and this is also based on core principles of primary healthcare of World Health Organization, and then we adopt it to country level. We do not duplicate it, but we adopt their guidelines, and that's why WHO has a lot of regions, a lot of regions. They have experts that know the countries, know the regions, and there is no other in international frameworks organization that can be alternative to this multilateralism. There is not such an international organization that work every part of the world and know their health. That's why I think it should be not easy to leave this kind of organizations, especially it's about our health.